Tonight, we get a special guest right here. One can talk about something very important. We give a do it's me and you and everybody. MPOX. A lot of people in the area about MPOX, whether I get the understanding about it or not. While you listen, you can go to our Facebook page and ask questions, comments, or a contribution. We'll get the expert right here. So, with that, the expert will introduce himself. Say hi to viewers and listeners out there, bros.
Yes, DJ Base, thank you very much. Good evening, viewers. Good evening, everyone. Me and Dr. Mustapha Jalloh. Me and the acting program manager for Public Health Emergency Management and Response, now the Public Health, National Public Health Agency. So currently on this MPOX, I serve as the technical operations lead.
Okay. Technical operations lead. Can you expand a little bit on that? What do you mean? What's in your work?
So basically, in outbreak management, we get what you call incident management system.
Okay.
Where we use for manage every type of outbreak or disaster. So you get the one where they call the incident manager, and you get other components where they call section chiefs. You know, so then are four of them. Me now one of them section chief. So anything related to the outbreak, other technical areas them, me then they report to on day-to-day basis, and myself they report to the incident manager and the leadership of the agency and the ministry.
Okay.
Meaning the one who they do risk communication, community engagement, the one who then they do surveillance, the one who then do laboratory work. Every day me they engage them, then they report to me and do presentations. Then myself escalate some of them findings to the leadership. Now some of them findings in the back we they put now with situation report, where they share with other stakeholders and key partners.
All right. Now, MPOX, what's I come? What's it about? What's in MPOX?
Yes, DJ Base, thank you very much for this. I think every time we go and start with waiting at MPOX, very, very important. We always want to give opportunity to other people and for get small understanding about this MPOX here.
Yeah.
So before this time, they call it monkeypox.
Okay.
Waiting at this monkeypox here, this is start in 1968, where they mean get some monkey there, where they mean they are some zoo, they are Western, na European countries them, where they mean. So them monkey then they after some time then develop something like rash. So they mean observe this year, then get like 2 outbreaks, you know. So now from then they name them monkeypox. In 1970, but by then they already talk, so now from the animal to animal will be no. That's from one monkey to another and other animals them. But later in 1970, then we record a human case in Congo where somebody gets infected with the virus. So now that tended the animal to human transmission begin. But this MPOX are now a viral disease. The virus where they call them monkeypox virus.
Okay.
Yes, it belongs to a family what they call pox viruses or poxviridae. Now they get smallpox, now they get cowpox, same family. But you know the smallpox immunodome from the 1970s, you know they again. However, later they look at this MPOX here, then classify them into 2. Then get the one they call the Congo Basin clade, and then get the one they call the West African clade.
Yeah.
Later then they rename them again. That Congo Basin clade, then rename her as clade 1. Then the West African clade, they name as clade 2.
Okay.
But then clade there also get subclade, when are A and B.
Okay.
But for we in West Africa now, all this while, now the clade 2, 9 they circulate in West Africa, including Nigeria, Ghana, Ivory Coast, Guinea, Liberia, so many other countries them.
Okay.
While in the Central Africa part of the continent, then gets this clade 1, where they na Congo, they na
East African area.
Well, central, yes. Now they move now East Africa and other countries around them, Burundi, you know, this country, Central African Republic, and so on and so on. So then they with that, but the clade 1 na in severe as compared to the clade 2.
Okay.
We'll get in West Africa.
All right.
Yes. However, we don't see some level of severity now in this current outbreak. Current outbreak we'll get. But this is not the first outbreak. So since that 1970, we don't get some half outbreak there. But the major outbreak, when the global outbreak, start in 2022. From 2022 to 2023, even major countries and big countries in the world record cases them.
Okay.
Also in the West, African countries, Asia, South America, beaucoup, North America, beaucoup record cases in the.
All right.
But we find out say that outbreak now the one way they move from human to human, we call it human to human transmission, not to animal to human transmission.
Okay.
You know, Sierra Leone not the first this for record MPOX database. In 1972, then we don't get a report say we get case in this country. Fast forward in 2014 we get case Nabo. In 2017 we get case na Moyamba. In 2021 we get
not
case,
as much as this one now.
No,
Yeah.
the severity different
Okay.
and the transmission rate different. And in 2021 we get one Koinadugu.
All right.
However, when the outbreak starts, this current outbreak starts on the 10th of January 2025.
Yeah.
A few days later, we collect some sample that we do what we call genomic sequencing. We sequence them for try to understand the origin of the virus
Yeah.
and how it done it. DJBase, we find out say in that findings, it tells we say this virus has been known come back in 1994 from Ivory Coast.
Okay.
When a human and an animal to human transmission, that person has been getting through. So the virus continued to circulate from 1994 to 2002. It's still in this country. The strain shows it moved from Sierra Leone, it go to Nigeria.
Yeah.
From Nigeria again in 2021, they said it is reintroduced into Sierra Leone again.
Okay.
You know, so since then, the virus don't circulate. And one thing about viruses, when you give them the environment for the move from one person to another, now so then they get copies on genetic makeup from that proteins and from that individuals them. So then they become more virulent and very hard for control. You know, so this human to human transmission we don't occur.
Yeah.
Now make we don't get so many cases them today. And not to Sierra Leone no more. As I talk to you, so we don't get call from other countries them. Where well, they not been they do what you call active surveillance, like where they look for cases them.
Yeah.
But currently they don't begin get number of cases them. We're in our neighboring countries as well.
Okay.
Yeah.
All right. So now, what are the difference between monkeypox and chickenpox? Because I believe, say, a lot of people don't really get understanding about mpox or monkeypox. The signs are almost one similar. Only with area, you know, people go say this young call them BB. So what are the difference between monkeypox and mpox? I beg your pardon, monkeypox and chickenpox.
Chickenpox.
And what are the signs and symptoms of mpox?
Yeah. So before they go to the signs and symptoms of mpox and chickenpox, the difference.
Yeah.
Now we talk about even the virus itself, what they call them. Even though they all are viruses them, but then they come up from different family, and then like I said earlier, mpox now from monkeypox virus, while the chickenpox now from a virus we call varicella zoster virus. So meaning they come off the origin different. And secondly, if you look at even the name, how they get the name, the monkeypox deriving from a monkey, like I've been explained, said, I mean, first identified as now one of these zoos in Europe.
Yeah.
Then the chickenpox, this now a name where then get because it gets on in way come up, it gets on red spot, and that spot they can feel some fall them. We look some fall the way we can men. They see that red spot pan spot pan. So now so the name, but that no mean say now from chicken they get out. The name after that, we get. Yes. So coming to the signs and symptoms for mpox, what they call the monkeypox.
Yeah.
The rash, most times it is seen as some people in palm and the sole of your foot.
Okay.
Where they see in chickenpox. Then the rash also, they come up chickenpox rash. They come on a genital area.
Okay. The private part.
Yes. They come on the way you can come on other parts of your body. Then when you look at the rash, they start again. Mpox, most times it start na you mouth, kind of the face. It is more prominent na the face as compared to chickenpox.
Okay.
Then the painfulness of the rash, mpox rash is very, very painful. If you interact with somebody who don't get mpox, I would tell you say it's very, very painful.
Okay.
Yeah. unlike chickenpox, chickenpox, the itch is more prominent than the pain, you know. Then also, in terms of the sore waking occur, the healing process. If you look at the chickenpox, MPOX, it will take you like 2 to 4 weeks for you fully recover. Unlike chickenpox, now 1 to 2 weeks, they see the person will recover.
Okay.
Yeah.
All right. So how serious, I mean, government take this fight, Dr. Jalloh? Because I don't know. Just give me, I mean, take with today, what are the updates about today? What are the number of cases and the cases and the increase, and why did they increase?
Thank you very much, DJ.
And also maybe at the epicenter also.
Yes. So basically, as I talk to you now, today, we're at the 28th of May, we don't record over 3,243 confirmed cases. Most of them cases in common at the western area, urban, followed by the western area, rural. And the third now is Bombali. We then don't record over 174 confirmed cases. So when they say confirmed cases, DJ Base, these are cases where we don't collect sample, we carry them in a lab, we conduct what they call PCR, polymerase chain reaction.
Okay.
Where not like it can go to any lab you do them. We get designated laboratory the way they do them well. So now they will
they're in a salon or out of salon?
On a Sierra Leone,
okay.
DJ Base. We get labs then almost decentralized at regional level.
Okay.
They do this testing at McKinney, they do on a Bo, they do on a Kenema, they do on a Fritonel. 3 labs and there then they do them. The 34 military hospital, Jue hospital, CPHR, when at the central lab na Laka, also cannot get the capacity for doing.
Okay.
And with the intent, cannot also the test now. So some of them results that they get now across almost across the country. Yeah. So now then one they will call confirmed cases.
Okay.
So for the past 1 week, let me say 3 to 4 days, we get double digit as compared to week 17, 18, 19, and 20.
Means it increase.
Yes. So we get
double digit now.
Yes. So we record cases them. This now because we make great effort to ensure say we look out for cases then which we call active surveillance, and also cases when they can our health facility, we're able to capture them as suspected case, then collect sample and test them. You know, when you look Sierra Leone today, the testing capacity is very high. Some countries then testing capacity low. They know they test much. Some countries then now maybe now one side and they test. So now 2 sides. But we don't decentralize the testing. But I make you see we they capture so many cases as compared to other cases countries. So as an agency, an outfit or in a technical outfit for charged with the responsibility for direct and coordinate public health emergencies or outbreaks in this country under the supervision of the Ministry of Health.
Yeah.
We don't do a lot. Like I say, decentralization of laboratories.
But the cases then still increase, Dr. Jalloh.
Yes.
So why didn't it increase?
Well, it means, like I tell you earlier, this virus will not circulate from 2021, meaning human to human transmission.
So how are we don't prepared? Because I know say, I mean, you didn't a side way, give a preparedness, response.
Yes.
Is it that we're not being prepared for this?
No. Not at any point in time.
Because failing to prepare is preparing to fail.
Not at any point in time.
The rate at which the thing don't increase now, Dr. Jalloh, you said don't talk with the record now, double digits,
yes.
Which is a concern.
Yes.
Means the 6 still the spread and...
So meaning that why would they pick up the antenna? Because we they really respond to the outbreak.
But it still increase.
Yes. So you know in epidemics you get a curve, epidemic curve. It starts and go, it reaches level where they get the plateau stage, then you get a decline phase.
We know which that curve date or we wait for the curve.
We are not waiting. We are not waiting for that. That's why we're in action. DJBS today, we engagement now waiting. One, for create more awareness and educate people on this. And this has been ongoing. This is not the first engagement. This other engagement and other media outlet them. We don't send out like how we've been discussed. We don't put some public notice. Let people and take some public measures. These are deliberate actions.
You think so really people don't get a message, Dr. Jalloh? Or people take this sick serious or they even believe relieving the sick, because sometimes it's like me. You go with me, say, I remember about 7-8 months ago, I've been in at the same studio before I travel going to the UK, where I've been get Harold Thomas now. We'll be talk about this sick way. Some people will be say, in fact, whether it's coincidence, it can't meet up. They told Donald Trump coming, cut Baku aid to Africa, we include WFP, who get for do medical business, and some people then they say, something that money they want to make, then they bring MPOX. So we left. People, they sit down, they say it was like 1 case, 2 case, 3 case. All of a sudden, we record 2 digits right now, and we don't record up to 3,000 cases. Is it not alarming?
So, DJBase, like I say earlier, on our part, just like I say, outbreaks na everybody concerned, and also na.
But you think there's some people really concerned this time?
Everybody need to put hands together for ensure say we control the outbreak. It's not about Ministry of Health nor the MPH alone. It's not about you, DJBase here alone. The whole of society approach. Everybody for come on board. Now we don't intensify our effort in terms of risk communication and community engagement. We don't deploy youth there. If you go, there is sound trucks and some communities for the past couple of weeks. All this now for continue for create awareness. The denial of MPOX, I'm sure not the first one. This what people don't deny. You remember Ebola being caught in this country?
Yeah.
People in they go there, people in they die. Still in they deny. Say no, this not to now witchcraft,
yeah.
not to natural something. So we they manage then thing and then misconception and then or misinformation in our society. Now make we get the risk communication and community engagement arm. We they do what we call infodemic. We they listen to what people in they say around and give them the right message. We always they give them the right message for ensure say people they understand what they go on and accept the reality for the moment.
I've been talking to Mr. Harold, also Dr. Jalloh. We've been talking, say, money not even there for help for this fight. You don't think, say, maybe not that they hinder this process, so because, they already jingle on radio. First time we come to like Corona, Ebola, music, then they come on, awareness songs them, you see people then ask kids them. But this trip, nothing like that, they happen. And I would say I don't go certain places where they come, people they shake hand, people they tight inside motor car, people they do more chillings, people they make party. And the other thing again, I be here and I don't know what you will say about that. Young people and institutions society, young people they go also, like then colleges, them they think they go more. So what is that? Because if you look the young trend now, it's like enjoyment, man and woman business. So
DJBase, as I talk to you so now, we team them, the risk communication team, and they engage institutions them, even nightclubs. They are going to nightclubs, and we also engage people them, commercial sex workers to an extent. They go out the night, and they engage people them, youths them. They don't go to institutions. We get records of that. The DJBase, not only in Africa again, as I say, in other district them. This weekend, you see where we engage almost all media outlets in this country through the simulcast, where you see Mr. Owl and the other team members there. Go right round, the message they go right round. Well, we they see some people and they make effort, DJBase.
Some?
Yeah, some people and they make effort.
When a majority for make the effort?
Yes. So it takes, they try for getting the right message. We always they preach to
when,
the right
why is the sick the increase?
So now make with the continue.
Oh, they wait for the curve.
With continue for do active case search, continue for create awareness, educate people them, give them public health guidelines until we science tell we say we not take this. DJBase always we they do as an like I say we are a technical outfit on public health. We know they take actions by emotion. We take actions by data. Now with data and all this effort what they do, not to like MPH will sit on a corner.
And the data don't increase.
Dr. Jalloh and team and they go sit on a corner and other people and say, okay, now this will do, now this will no. We are guided by science and other well-body partners.
All the data when I look Dr. Jalloh, the case still increase. So that's the problem.
So, like I said earlier, the increase in number is because the virus is transmitted at community level. Now make we go down to the community, we deploy team members and community health workers for create awareness and do active case search, advise people then for seek medical care, and give them tell them about the preventive measures. So now we could intensify with effort across board today.
All right, Istanbul, this is my program, The Hot Seats. Me and Mustapha Jalloh, to the DJ base. We get Dr. Jalloh right here, where they talk about the work that they do, the need for preparedness, response, and from the thing done, they increase every day. The statistics done, they should say now we get double digits, which is a concern. And fam will send me a message on the Facebook page and let know what you think about this MPOX thing. We're there till 8 and the case don't increase. Again, Dr. Jalloh, of late, one popular TikToker died. I don't know if you don't hear it, Andy. Well, again, whether it's true or not, within, I didn't want forum or somebody they say, this person died of MPOX, while somebody they say, in order to the names of people and we. So how now they get the data of the names of people and we die of MPOX? How now they get the correct statistics if somebody died of MPOX now upline and no reporter?
Well, when you know report, we know we will give account to which they no report. But across the country, DJ base, we get a designated treatment facilities where we manage MPOX cases.
People are good there?
Oh, sure. People are good. Currently, we don't even establish a treatment facility in Hastings where they take more than 200 to 400 patients them. You know, so we also get treatment facility across the regional, the district township them. Also, we get other facilities that also they manage cases them. All the while we follow up on them. We get a system, when our surveillance system, with every day in the report from community level, country health facility, from health facility to the district, from district to we national. This system they operate 24/7. So if somebody they within with treatment facilities, or somebody who we know say yes, this person they home, but a confirmed case who they follow up with. If anything happens, we record them. So as of now, we don't get about 15 confirmed, 15 deaths. You know,
nationwide.
Nationwide,
okay.
Since the beginning of the.
What's the epicenter of this MPOX now?
So when you say epicenter, Western Europe, but now we don't record the highest number of cases. Okay. You know, of the population size.
Within
Freetown, yes, and the movement of people, interaction, all that, and most of them people that will die, DJ base.
Yeah.
Then some of can get other underlying condition. You know, before they get some people they get this MPOX here. Maybe get other sickness. We don't weaken your immune system. Okay. So mostly now them people and you can see they die of this disease. You know.
All right. Okay. Now again, I'll be asking one question: if we get the money for fed this case compared to Ebola and Corona, or outside people and support this one?
DJ base, I think that's very important for people to understand. But the most important thing is that how prepared you are. You can get the money, you don't get the human resource. Sierra Leone today, DJ Base, I would tell you, say, when you talk about outbreak management, emergency management, we stand tall now Africa.
But get MPOX the case, then they go up.
At times, not the money, they control outbreak. You see when COVID came at the world, countries, they know they get money. Then get money, we're not going to say they don't get nothing for doing.
Right.
But money there. But when the outbreak come,
so it's all the human resource still the case and increase. So the problem there.
So like I say, outbreak management, not to one institution, not to an individual.
So why the case and increase, Dr. Jalloh?
DJ base, we get what you call contact of cases. So what we do as an agency, when we surveillance suspect you, then can you go to a health facility? Like I say, we collect your sample and test. If you confirm positive, but why would they do that as a suspect? Would they do what you call line listing? Like I'm here to don't interact so in our studio today. If me a positive case, DJ base is a contact of Dr. Jalloh. Your phone number, your details, everything, your address, then we collect them. But if people fail for you, then correct, even in correct name, then when are the patient themselves? You don't give correct name, you don't get correct name from them. Then in contact them, and say, what's your address? It's in Awatalo. Who's partner Awatalo? It's in Awatalo. If you me go for go find you in Awatalo, how I would team up and see you? database. So this become
one of the problems then.
This become one of the
People
problems.
giving the wrong information.
Yes. So if
Privacy day back also, maybe people in fear say if their privacy go be kept.
yes, so we when this outbreak start, the leadership been engaged the Ministry of Social Welfare. We will get team we join we in a psychosocial team for ensuring that they able to talk to them people that counsel them so that we get enough information from them. If there's this information they are unable to get them, you understand? This person here go don't grab, you don't go to a club today. You get two girlfriends also side, one side, the other one this side. Then you don't go there with your mama, you don't go to the people. So you don't interact with so many people. But if you don't give the details of them people that are database, how will we able?
So that's one of the problems, or not they make it increase?
Now one of the key problem, Andy.
Okay.
That's what we call contact tracing.
All right.
Because those people have to be followed up with. We'll be able to follow up on them. And also, now make you say the vaccine mainly now for them people in there.
All right.
Because if you're able to vaccinate them people in there, you break the chain of transmission. But if they not give details of these people,
so why
you know, but I'm not saying this now generally now for everybody. DJ base, we get.
So why not the quarantine people then?
So we go restrict, we isolate you for ensure say. I mean, interact.
How long gonna they isolate people?
We follow up on you for 21 days.
You then I also do follow up?
Yes.
So
that not the one thing where they give them full information. If DJ base then number 2 service street, we community health workers and they go visit them on regular basis. If we get DJ base in correct telephone number, we they call and say DJ base, your body warm today? This you understand? You see any rash in your body?
So the one when they get back to and then they go and spread the sick back or what's happen?
Interaction occur because it interact with other people them who we don't know.
Okay.
Yeah.
So money not there for do this trip, for do sensitization and help fed this feds.
DJ base people in there out, create awareness. Surveillance
people don't get the message, Dr. Jalloh. You said go argue with me. If you go inside town, people crowd all over, people still they shake hand, people they crowd in the market, work a fine boss and they choke and they over. I mean, even some of the hospitals and stuff now even get the hygiene measures.
Meet up few weeks ago, we not shake hand.
Yeah.
Me and you not also.
Yes.
Because you don't aware say this year.
But other people in the door.
Good. So now make we continue for create awareness. Educate them.
So is it that because money no there? Because no say when I also engage people and during the time they would get corona Ebola. The heads of different for example like a community, church, imam.
DJ base.
Yes.
We get record of all the institutions.
But not the didn't say in a mosque.
Who don't engage.
Not the pastor there and imams and the preacher in a mosque compared to the other thing who engage other programs.
They've been engaged.
Because then a lot of people in that place
records, response record, you go see where you do orientation.
For sometimes then they deliver the messages
for religious
to the
leaders, we did orientation for commercial sex workers.
For do and one, when I make sure say then delay them.
DJ base not money they make, not money I need for take for let you me to store for shaken. Now money, they don't require money.
No,
not money. We need for let you not go hug somebody where you know say gets ample. Not the money we need for tell you say if your body they hurt you or you feel fever, go now hospital.
Right. So the vaccine
all that they not require money. Not also, and the ways then they for stop the transmission.
Dr. Jalloh, we get the vaccine and we not the quantity. We get enough, it don't done because say a lot of people they don't even give vaccine. Yeah. And one problem also about the vaccine, I remember they were before some time, some people and say they come out 34 and go give the vaccine. They don't give the people a card for sure say we don't give the vaccine. So what are the process for? Because then one day they not give card. How then go able to know say then don't take the vaccine? So the vaccine there is enough. Look get the information, Dr.
Yes,
Jalloh.
DJ Base, thank you very much. So vaccine now one of the preventive way then for stop any outbreak. However, when we fight Ebola now, we've been seeing the vaccine for Ebola, there was no vaccine for Ebola.
Okay.
Also, but we end Ebola. Why? People they end up for adhere to public health measures.
Okay.
Not also.
After I don't kill Boku.
The people they adhere to public health measures because vaccine not be available globally.
Okay.
MPOX as well, the vaccine, they don't develop vaccine, but it's still limited globally. Sierra Leone of a population of 8 million. receive 58,300 doses.
Okay.
Bigger countries, and they wouldn't get a population of more than 200 and something million. I will not name countries.
Like Nigeria.
You understand? Countries wouldn't get huge population. We get countries wouldn't get over 60 million population. They only receive between 10,000 to 20,000.
So why didn't you Boko?
So, the way we put our case forward, we request, and secondly, the relationship of the MPHA and the Minister of Health with other well-bodied partners, them be able to help for push for get, and then still they continue for ensure we able to get more. But this is for tell you say, the vaccine scarce globally. Even Congo, when at the epicenter in Africa.
Yeah, don't talk about Salon.
Yes.
No.
Now they say.
When are the quantity again up at the 50-something thousand? How much left?
So we currently don't vaccinate over 40,000 people, and majority of them na frontline health workers, we na a barrier. Secondly, we focus on contact of cases. So the people then where they able to come forward and give them contact, like their family member, their workplace, we ensure we vaccinate them so that they don't continue for transmit the virus. Right. We also target, like I tell you, say people who don't get weak immune system, where them system don't weak, where them vulnerable, we call them the key populations. We also target down there for ensure say we stop the transmission, the chain of transmission.
So I don't know if you remember what's happening, right? Which means to get less than 15,000. Vaccine now after 50 something. 40,000.
As I talk to you, so the JBS, we don't request more because we don't justify with vaccination.
But no kite.
Soon we receive more.
But no kite.
We receive more vaccine.
But no kite.
However, the JBS, like I tell you, adhering to public health measures. You and I not take vaccine, but you they ensure say today, you and somebody who they stand apart small, they interact closely with somebody who you not show off. Not so. So if we continue for do them good practice then they coupled with the vaccine what they get, I think it will help for stop this transmission in the country. All
right. Again, the other thing again, how then they give the vaccine? So then you then get some children they give or then just give vaccine or because me not take it and like I said go before somebody who just go take the vaccine but they not go paper. So what are the process or the procedure?
Yes. So all the contact anybody not MPOX vaccine no more. Every vaccination process what they do in this country, whether now for Pekin or now for adults now, even COVID-19 vaccine. And they give a vaccination card. They proof and evidence say you don't take the vaccine.
So what's going to happen to them people where they don't give cards so when they give them the vaccine?
Well,
they say
these are isolated cases. Now team will go investigate and know because we as an agency we are very concerned about some of the information there.
So
we go investigate and try for no. But these are isolated.
So when they give people in the vaccine, Dr. Jalloh, then they can't give an account of which they give out?
We get a system. So the vaccine is distributed across the country. Every DHMT, when a district health management team, then get a team for vaccination at that district day. Whosoever then vaccinate, we get a system. Who say then input all land day and the number everybody.
So how they go input them? Why would they not give card there now?
So now make they tell you so DJ base. What you they talk so? What you they say so? Now an isolated incident. We
maybe
will investigate.
Maybe before you are able to talk. Maybe it could happen on Bakusai.
What now make I tell you say we know any information we get, we handle out seriousness. We ensure say we investigate.
I meet friends. In fact, somebody said I go take the vaccine,
so,
but the card don't.
As we talk so now, DJ base, you know one clear individual will guide me for showing some of them people there. And we trace beside and they happen.
Now will force happen. Will
now they say so. We will trace beside and they happen and go verify and take actions, necessary actions.
When I do that because then they're not going to give correct information about how even the vaccine they go. If they're not going to returns of other than give them something for representancy, then give them. But anyway, let's just go to another one now. We don't find out, like I tell you, there's a popular TikToker on social media with their flates. I don't know if you go able to confirm because we see picture outside them. It puts, I don't know what, like say, MPOX. And it don't die now. Though some people they say, well, I listened to a video this morning where they say it been a mental problem, but again, a lot of people they say na MPOX killer. How now go able no say this person of this sicky die if they not go report?
Yeah, thank you very much, DJ Base. So, investigation not a one-off something. I know okay, tell me say then they give people them vaccine, but they don't give them card, then generalize them as a go.
Okay.
So what do we do? We get a case management pillar where now people who they experience even beyond Ebola, they don't do this work in other countries then. Now then they lead the case management. So when we get a death, then they ensure say they investigate what thing caused that death. You know, now medication error, now other underlying disease condition then, what is that?
Yeah.
If then go test somebody, then she say in CD4 count very, very, very low. You understand? Against a particular virus, and he can't get his MPOX. So then they sit down as clinicians, them, they analyze the situation and try for no say, okay, this person, he died, although he don't get the MPOX, but not to the MPOX killer, you know. So that issue there of that TikToker don't come up. The case management team, they investigate. And once they investigate, they come out clearly and tell people and say...
Inside the hot seat, we get Dr. Jalloh. They talk about MPOX, so you can send a message that we can able to read out to you, and the experts right there for able to answer a question. But before that, let's just take a look. We colleague been go out there and talk to people about MPOX. Let's listen to it and see.
MPOX now viral sick we don't can Salone, and since January, Salone record 2 cases, and now we're in May, inside this year, when at 2025, Salone do record 1,400 and more cases of MPOX. Today, we come on a street to ask people which precautionary measures that they don't put in place for make sure say this sick will come on at the country.
Well, the monkeypox virus, I know so know too much about where I they watch the sick more on Facebook when they show we how the sick the old people them, we they get more fear. Because we don't know now who's vaccine and get for face for we. Because we don't know if the vaccine don't come. We don't know it. Because imagine this kind of sick don't come. Any government gets you sick, we don't know. But we they pray to God, Papa God, let forgive we and sorry for we for this sick here, let push and far. Because we the poor one, we the layman, we don't know who's vaccine and don't provide for we for take healing and cure.
MPOX sick. I not get any idea concerning how it affects person, but I don't read about say it. But how it affects person, just like how the awareness been there about Ebola or I don't call them the other sick we have been get. I not get any awareness of it.
Basically, we all know how the Ebola and COVID-19 be ravage many Sierra Leoneans, because some of we at the initial stage by then, plenty Sierra Leoneans they mean denying say the virus not true. In the case of this monkeypox, I believe say we for don't learn a lesson from the COVID and the Ebola. See the notice from Ministry of Health and then partners them. Everybody for adhere and follow to the precautions so far away they don't state.
I think it's a place of where people are not actually want for the to pay attention to them, and I think people that don't take it lightly and they realize that the precautionary measures them where they don't put in place, but it's something very serious, and I think we Sierra Leoneans actually need for take the precautionary measures them very, very seriously, because that thing is very deadly.
The Well-Body Ministry be don declare public health emergency inside January 13, but inside February 25, Salone don receive over 61,000 doses of the MPOX vaccine where they call the MVABN. Them start for GAM to health workers there and people where they at risk. For now, some sick people they isolate now house, but government plan for move all positive case go na hospital. Then say that they build one 600 bed center na Hastings plus facility then na Kalbatong and Port Local. Some people don't talk how they feel about the new law them from the Well-Body Ministry.
Area of overloading and them because this sweat don't also cause people and they get infected. Law makes us see will take the precaution for the reduced low get social distance. And that vaccine will able help you for curtail in case you get any community where the jam will post them, you know, we will affect.
Well, let me don't start, but I think say the school they don't cut off, and so with the big government back for let them begin go around. So that buckets they go still they like them do one for Ebola, then do one for Corona. So let them still do one back for let the buckets go still stand for the wash hand.
Fine, because if not that's not the go solve a problem, that go fine. That go fine. Just like how we've been fighting Ebola, if we do the same thing, I believe it will help we.
New law then now they apply to school, working place and safe public areas them. For what's where they enter and commonado of every building where you go. Hygiene posters them must there. 1 meter space for there between people there. Not for touch people there or go side crowd there. 21 days for monitor anybody will get rash and fever. And for call 117 quick one if you show any sign of MPOX. Government they beg everybody for remain careful. What's there and they report any sign of MPOX. And then for call 117 or go to the nearest health center. Then say if we all work together, we go fit tap this outbreak na the country. Mariam Atomi, AYVU's Freetown.
Welcome back, and then our colleague Mariam Atomi will go out there. Dr. Jalloh, if you listen to some of them people and they I go tell you say people that don't really get the awareness about MPOX. So posters themselves will know they see, schools themselves the message know they flow to school picking, and sometimes they say even before school they open, if we've been there when for they engage the schools them, so that message they go sink down past, like you mentioned, people like you go tell picking and say wash here and always, but the message not there out there.
DJBS, thank you very much. I think I don't look the video, and when you say the message is not there, this is an interview of a handful of individuals.
But I mean, survey stuff not so they do.
Yeah, I understand. So you go find out among the one that they interview self, you get people when they get concerned say the populace they downplay the sickness.
Okay.
That tells you that the messages are not they out. Somebody don't mention about the public health measures them, we don't they out. Tells you individual then they we're really aware and they follow some of them guidelines and they. However, some people, and you see some people raise concerns say, for vaccine, you know, that they tell you say, then concern about the sickness, then no say it, you know. So we will continue for create this awareness, engage institutions then, other communities, individuals then, across the country. So now a continuous effort where we do, and we do them and we'll continue for them. For ensure the awareness is there.
Recently, regulations and they will be come out, but we not see that nobody know they for enforce them. Social distance, avoid crowding, and all that kind of stuff.
So DJBase enforcement na another level where they involve other institutions them, we na then your own domain. But
which rate?
You know, response get levels. And now make it see me and you today, we know they shake hand, not also, and many people outside there, they do similarly. So this message, them measures that we don't put in place, we get to follow up on the populace and see how then they adhere to some of them things there, you know, before, you know, them measures there not to for make life difficult for people there. Now for protect me, you, and other people, like family members them, for let them not get this sick here. Yeah, so we will continue for follow up on people them and understand the science. We don't get some anthropologists them in country within the, I mean study.
So Dr. Jalloh, how much thousand the thing will reach for reaching curve where you say the bend? Now we're talking about 3,000. How much thousand?
We can't say about 1,000. We can't say about hundreds.
But we're inside thousands now, the cases. There.
Yes, but now make it see. A lot of people don't recover from this disease as well. DJBase, we need to understand this again. More than half of that population, affected individuals, don't recover full, and more they discharge more in this.
There were also some allegations, I know now true, is that some people take the vaccine, then still end up forget the MPOX back.
Yes. So let me understand the science of this vaccine generally. So the virus itself get an incubation period of 3 to 21 days.
Yeah.
So if you don't get infected between that period, we don't manifest signs and symptoms yet, then they can't give you the vaccine, meaning not meaningful.
Okay.
You still forget the disease because you
so the vaccine able break them?
No. So vaccine now they say if you take it within that period, you already your body don't develop antibodies them. The virus don't already start to replicate.
Okay.
So taking the vaccine, I make we always advise if you're in a case, please show where you contact them immediately. Vaccinate them.
Okay.
For let the person not get the virus, or let the virus not begin replicating in the system.
To other people.
Yes. So maybe then one day they wouldn't talk about. Nah, that's going to happen.
Okay.
Yes. Not that the vaccine not effective. This vaccine, before they begin using it in this country, not we force don't use them. Other countries don't use them. And also we get an advisory committee in this country on vaccine, where these now people where vast experience. In fact, they are retired people in public health, very vast experience. Then they look into all this, the science around the vaccine, before they recommend. Ministry of Health or the agency or the API program, or they start for vaccine, do any vaccination in this country, if then people and they no recommend.
Okay.
And I made them tell you, say, for this vaccine, we only they give people from 12 years and above.
All right.
Because the recommendation that they will get from them, from which they don't.
I don't see a video where small picking also get her. Is it true?
Yes. We don't get few cases where 2 weeks old baby don't get her. We don't get a case of 1 year old, 3 months old. But these are countable, now few numbers as compared to the general population. Like I have said earlier, the age group most affected in this outbreak, now the ages between 20 to 34. And between that...
The youth age?
Yes, the youth age. And between that age again, we'll see the age of 24 to 29 account for the highest.
Okay.
You know, when we do the analysis. So now make today with the target young.
And they give it to universities and then place them those young people.
Then we target young people them. If you look some of the videos that they see with team, then they're gonna attire base, then get to secondary school. I just come on McKinney and Potloko while rushing to the studio now. So we don't see who side and they go to some of the university for engage them, student union bodies, for tell them, create awareness, make them talk to people because we don't know Sudan are one of the target population for this outbreak.
All right.
Yeah.
And Western area na the epicenter. Now they sick them more.
Yes.
All right. We got 5 more minutes, but quickly before we wrap up, again, we'd expect forget. Well, I don't want to say lockdown. Maybe measure will make them so okay, reduce the seats. Pan pura or let people like social distance and that kind of stuff?
For control an outbreak, it's guided by science.
It increases every day, Dr. Jalloh.
It's guided by science. And the public health measures they wouldn't put out there, DJBase. If each and every Sierra Leonean adhere to the public health measures, we'll be able to control this outbreak as early as possible. We will continue to engage people, create awareness, go around, continue to go to institutions, tell them, say, let we adhere to the measures there. Because when the outbreak continue, the DJBase, not so we know what it affects. It affects businesses, it affects the whole economy.
Of course.
It affects everybody.
Not
so. And we get with people when they die of this disease, we don't want to see them die. So
it can also affect relationship with other part of the world.
Yes.
Traveling and all.
Yes.
If you want to go there, say no.
We they ask people, we continue to talk to people. If you get any signs of symptoms of any type, whether na MPOX, not to MPOX, or go to hospital, let the well-body people and
any hospital, like a specific hospital.
Nearest health facility.
Another
you go to the nearest health facility. Every facility, we get levels of facilities in the country. We get primary healthcare level, we get secondary healthcare level, and tertiary. But when you go to any PHU in your community, then they refer you to the secondary or tertiary level. Then at that level, then they even call surveillance people and for can investigate and try to see whether you meet what we call case definition of MPOX. If you meet the case definition, then they collect sample from you and send an allow for test. So we follow up on you, contact them. Now, so we want to let people do. Go to the nearest health facility, or like they say, call 117 and say, I didn't so I feel this, I feel this. We will send other people and surveillance team for go meet you at home and see if you meet case definition of MPOX. All
right, Fan Bulletin, I don't get to stop the show for tonight. We appreciate everybody out there. You will watch we on Facebook page, you will watch on television, you will listen to it on radio, or you will listen to it online. We hope see you with this Sierra Leone go take the preventive measures because I think it starts with you. I've been talking to Dr. Jalloh the first day we meet. It starts with you, Seth. Now you get to make sure say, because if everybody, what I believe say, will not get for happen back, if everybody take and say, it start with me, I know the shake hand, for now, I know they hug people and take the preventive measures, they not get sick, you don't get sick. And like Dr. Jalloh say, the vaccine not going to ever do, you know, and you take the preventive measures. Hygiene for be part of it always, but the problem not the land. We don't get Ebola, we don't get Corona. To me, all things they get to do with hygiene, where we lack. And we know they see big institutions and they take the measures them for washing, sanitizer, and all that kind of stuff. Again, your life then are your hand. You will make careless, I'm afraid. You go pay the price. And like they say, you will die in a loss. As we talk, so Dr. Jalloh say the cases and they increase every day, one at a time, one. So it don't increase. Means the people who get unknown, they scatter all over the place. So you take the preventive measures. Whether it's be somebody or not, left shaking, left hugging, you can talk the preventive measure quick before we wrap up. Okay, 1 minute.
Yes, DJ Base. I think the most important one, like how they say, handshake, minimize body contact as much as you can. Wash your hand with clean water and soap. DJ Base, this is not a very simple thing. We know they cost too much. Let people ensure say institutions them, public places them, let them ensure say then get hand washing station. Now them places there.
Yeah.
If you get a customer or a client, they wash your hand clean. And intimacy, let's be very careful how they interact in our society now. You know, because now skin to skin contact, most time people in the get this here.
Okay.
We they find out say some people in the cast couple, some cast girlfriend.
My main daddy business.
Yes,
more.
Direct contact, skin to skin. Now they able to transfer this mostly.
Okay.
This social distancing. Maintain some small distance with somebody we, especially somebody we not sure of, a garage or any other thing. Maintain social distance. And most importantly, now you also, who say you did, advise any family member or your neighbor in your community. If you experience any signs and symptoms, or fever, headache, or rash, let go to the nearest health facility.
All right.
Now only the well-body people will tell you say, this is MPOX or not MPOX. Rather than sit down and assume.
All right.
Yes.
So Nadano will left with you. If you've experienced then signs and day, a rash, your body is warm, visit the nearest health center. Now then go able to tell you whether, because sometimes you go think something, then maybe not so. But prevention is better than cure. And again, we advise people who get some go to the health center where we don't show them signs, because if you go back to your house, you carry more trouble go back to your house instead of saving your family. So till then, I want to say plenty thanks to Dr. Jalloh.